Some students will have guns on the campus at UT Austin.
But what has not been decided is exactly where those guns will be allowed. That was just one of the items discussed at a forum today for both advocates and opponents of campus carry. While some professors and students are in favor of it, others say they want the right to not allow guns in their classrooms, and they're willing to risk their jobs over it.
If there's a backpack and somebody has a gun in it, or there's one in the dorm room and a suicidal kid has access to that gun, something bad is going to happen.
I just believe in the very simple fact that being able to defend yourself keeps you safer.
That new law goes into effect August 1st of next year, and even though there's not another public forum, you can still weigh in on campus carry online. We've posted a link to the university's online survey with this story at KXAN.com.
The mother of the Oregon shooter says her son was struggling with mental health issues. There have been examples before. In 2007, documentation showed that the Virginia Tech shooter had gone to see numerous counselors before committing the deadliest school shooting in U.S. history. And it was the same with the Aurora Theater gunman in Colorado, who also had a history of mental illness. He killed 12 people who just wanted to watch a movie. You would also think a background check would have been enough to stop the shooters from buying guns, but a background check does not always show the red flags. KXAN's Phil Prazen takes a closer look.
More than 1 million people a year buy a gun in Texas and get the required background check, searching a person's criminal history, but not always their mental health record. Those are protected by federal privacy laws. In Texas, court-ordered commitments or guardianships must be reported. But according to Texas and federal law, information about a person's emergency mental health detentions or warrants, protective custody orders, or drug and alcohol rehab services cannot be made public for a background check.
We're not very good at identifying who is likely to be violent. It's a very small number of people who have mental illness.
Dr. Linda Frost from the Hogg Foundation for Mental Health says medical records are kept private to encourage people to get help. She believes any new laws with a more broad approach could do more harm than good, because statistically, you're more likely to get in a car accident on your drive home from work than to meet a mentally ill mass murderer.
All of us struggle at times. And so it gets very tricky to define who exactly are we talking about when we say the mentally ill.
In a way, it's the same argument the gun rights lobby makes. We should be wary of stigmatizing the many to stop the few. Phil Prazen, KXAN News.
Dr. Frost points out that 61% of gun deaths in America come from suicide. He says access to care is still the #1 problem in mental health.